Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is my man, David Pryor. How are you doing today, sir?
I'm doing okay, Bryan. How are you?
Just okay.
Yeah.
Usually, you're like, what?
You know why?
What is that?
Because it's 7 a.m.
Oh.
I didn't know they had a 7 a.m.
Oh.
What are you doing scheduling these? So I figured it out. I figured out why you have us scheduled at 7 a.m. Because you heard that I stopped drinking the Mountain Dew. And so you needed me to add more sugar to my life so that I would have to wake up using Red Bull to do so. So you're causing the decay of my teeth by scheduling me at 7 a.m. for a podcast.
Yeah, you found me out. Yeah. That's exactly why.
Yeah.
It's not that I'm always here at like 6:45 every day.
Yeah.
And that was the time I had in my schedule. Not at all. No, it was
No,
the anti-Mountain Dew pro Red Bull
Yes.
conspiracy.
Yeah.
Yes. Mission accomplished.
Son of a...
Well, sir, we were talking about this podcast just 10 seconds before recording, and you had a question that I thought was a very good question for us to discuss. And again, you providing the patient perspective, somebody who's doesn't work in a dental practice, never worked in a dental practice, been a patient of dental practices, including the one that we are kind of in right now. Yep. So could you kind of ask the question that I think was very poignant, because it's not just for patients, but I think, frankly, the entire profession as a whole is struggling with right now.
Well, when I do my demos on the Operatory stuff every day, I talk about why we do what we do in this company, and there's two reasons that I've distilled it down to why you created Operatory. Number one is that you created it to create greater efficiencies within the practice.
Yeah, absolutely.
And number two, you create things to improve the patient experience. Those are the two reasons that you do anything you do in Operatory.
So now, should I lie down and I can tell you about my childhood a little bit? Because that's probably true. I would not have been able to say it as succinctly as you, but yes, that is very true.
Yeah, and I can tell you all these stories about your childhood because
that's true. That's a good point. Back to Mountain Dew.
But we've spent all this time over the years of doing this podcast talking about ways to create efficiencies within your practice, and now we're in a post-COVID world. Most practices are opening back up. And I'm looking at this and talking to different offices all the time. I'm like, I don't know how you're going to get back to production levels that you were at prior to COVID, or even close, with the amount of stuff that you've got to do in order to accommodate our current situation. So that was my question to you. Like, what are the things that offices are doing in order to get even close to their original production levels?
Yeah, and I think that's a great question. And frankly, I don't know if enough dentists are asking themselves, their practices, that question. Because here's the reality of the situation. You are 100% right. I would reframe the discussion around, if you don't do anything, you are not, right? If you bury your head in the sand, right, as we've talked about a lot on the podcast, but it's a theme that, like, we as human creatures like stasis. We don't want to make change, right? And I was listening to a mentor this last week who framed it. I loved the way he framed it. Really just unlocks a couple things in my brain. That was like, you get to choose your suffering in life, right? So if you think of the Buddha, like we all suffer, right? But for example, if it comes to diet and exercise, you get to choose. Do you go through nobody likes working out. I mean, some people do. I'm not one of them, right? I hate working out. If I could just sit and play video games, I would rather. However, you get to choose your pain in life. Do you want to go through the pain of working out and eating right, or the pain of being embarrassed for the way you look and getting heart disease and diabetes and feeling awful, right? So you get to choose which suffering you have, but one way or another, it's going to suck, right? I think the same thing is true here with with the status of dentistry right now. There's some things that we have to do which already are painful. Like, I mean, let's face it, it sucks that we have to use an N95 mask and a face shield, and we have to make all of these changes. That's not, but it's better than the pain of going out of business, which some people actually are selecting to do. They're looking to sell their practice, get out of the industry, whatever, because they're choosing which way they're going to suffer, right? If you're choosing to stay in the profession, which hopefully a lot of us are, because I still think there's lots of great things about dentistry, and I think that we're on the rebound, and there's frankly going to be a lot of opportunities in dentistry because of all of this change and other people not wanting to go through the pain of the struggle of change, right? But what is totally true to your point, Dave, I believe that if you do not change, if all you do is the bare minimum to like meet the infection control and get your practice up to speed, you will not hit the levels of production that you did pre-COVID-19. So what does that mean? We have to do things differently, right?
Yeah.
And I think you have a few choices. One, which we talked about on another podcast, which I think is actually a very good option, is figure out how to be as productive or more productive doing less. So, you know, the common thing in my entrepreneurial circles, they say production, kind of in dentistry, production is vanity, profit is sanity, right?
Yep.
So if you focus on production, which I never did, right? I mean, but I would right now. We are right now at post-COVID-19. But so you can choose, do I want to increase the top line number or the bottom line number or both, or do I want to bury my head in the sand and be forced to suffer the consequences, more than likely, by doing that. And I think that's really, if the way I would frame it is, as a dentist, I would be looking at it that way. Do I want to really focus on increasing production, doing new procedures, right? I didn't do implants pre-COVID. No, maybe now I'm going to start doing implants. Do I want to bring in higher cases, like with, bringing in teledentistry, where we allow people with $30,000 arches reach out to us in a very safe, easy way and promote that now. Do the things that are going to draw people in, go through that sort of, if you want to call it suffering, or that work, right, is maybe a better way to say it. Do I want to become more efficient? Put in things like paperless forms and intra-office communication where we can get more done where we can be more profitable doing the same or maybe even a little less volume than before? Or do I want to just, spend the next 6 months figuring it out, being less profitable, and then maybe in 6 months I'll care? I mean, I think the choice is up to every individual practice, but it's an important one to make. I think you should be conscious of what you're choosing to do.
Have you identified any really easy answers for you in your practice, as in terms of, I've got to start doing this in order to try to generate more revenue right away? Like this is a no-brainer move. I've got to do this. What's your one piece of advice?
Well, this is Bryan lying on the couch. So
right.
Really, with my practice, we got fat, right?
Yep.
We've always been sort of production oriented,
Mm-hmm.
very profitable because we're really good at producing. After COVID-19, frankly, we were so good at producing that I'm wondering if we'll get back there for a while. So we're focusing on being more profitable. And the good news is that in dentistry, and certainly in my practice, there's a lot of fat to cut out. We had more people than we needed to do the same procedures. We had, there's a lot of, and that's really what our specialty is, being efficient. But even with that, because we were focused on production, I'm looking at it afterwards, going, the way to be, what I feel is the right move for my particular practice right now is to focus on profitability, because we can certainly be as profitable or more profitable with less volume, given how, because I'm not, that's one of the things that we talk about. I like taking action. I'm one of those weird people that thrive on change. And so during this process, when I was thinking about it, that's really the conclusion that I came to, is going to be, for the immediate future, like, we're going to slow down, become more profitable prior to scaling back up is really what it comes down to.
Okay.
I think for my particular practice, we can put in systems like, we're starting to do a lot more teledentistry. And really it comes down to the people aspect of it, right? We had more people than we needed to do the same volume that we will do going forward. And we're adding more procedures, and we'll do things that will increase production, but that's not going to be our core focus. The core focus right now is looking in the systems, hours, people, and focusing on profitability. But frankly, I don't know. I do think that as a profession, the volume is going to be lower, right?
Yeah.
I don't think, if your focus was a small boutique practice doing tons of veneers, that's going to be more of a challenge for the foreseeable future, right? We've talked about it on the podcast before. We're in the confidence building phase right now, where we have to build confidence in our teams, in our patients, and in that time, it's going to be, unless you weren't doing much volume, it's going to be difficult. If you had we have a big practice with 7 dentists here and lots of production. So keeping that going at the same level is harder than if you're one person shop with small production. Getting it's more challenging. But it's easier with our type of practice, I believe, to extract efficiencies and profit. So that's what we're focused on. And I think that as a profession, that is what most people would be. If I was looking at the 3, burying my head in sand, focusing on profitability or focusing on production, I think most people would be best off focusing on profitability. And that really means efficiencies, making more, doing less, with less.
When everything you said kind of brought up a bunch of questions to me, but so first question I want to ask you, you had mentioned that the boutique practices that focus on veneers are going to have a little more of a struggle. And I wanted to ask you, like, what and this, again, as you mentioned at the beginning of the podcast, I'm coming as an outsider.
Blank slate.
Right, blank slate. And so I would think that often cases when people are talking about veneers, it's a vanity issue. And I don't know that COVID is going to impact vanity. And so what draws you to the conclusion that veneers would be, a veneer practice would be impacted more harshly than everyone else?
Great point. You are 100% right. And I think that people will be doing veneers. It's not the vanity piece that I think it's really going to be affected. It's the pocketbook. I feel like we are going to be in a spot where overall the economy is lower, right?
Right, yeah.
I think this has been kicked down the road for a while because of what the politicians are trying to like delay this until after November because it's an election year.
Right.
But I believe once January of 2021 hits, I personally feel like we're probably in for a bit of a correction based on. It's just you can't shut down the economy for 3 months and not have some negative impact to people's pocketbooks.
20% unemployment. It's crazy.
Yeah, and those people, if you're unemployed, I don't think you're gonna. Maybe you'll put off getting a veneer so you get a job, right? That's really what I think is the biggest impact. Now, there's always, of course, there's going to be people doing veneers, and you can certainly have a small boutique practice doing whatever you want to do. Just statistically, it's going to be more of a challenge, so you have to up your game in some fashion.
Yeah, no,
right?
that makes sense.
And I personally believe that you as a dentist it's a great profession because you basically can do whatever you want to do, but you're not going to get there if you bury your head in the sand and expect next month to be the exact same as last month. In a world right now at this point in time, I can't even lock down what's going on with my hygiene schedule week to week because it's so much in flux, because patients' perception is changing every week, and which isn't necessarily bad. It just makes some things it makes it so now is not the time. I've said it through this entire process with COVID. The biggest thing is to keep your foot on the gas, which really means be engaged.
Yeah.
This is not the time to be sleeping at the wheel with your practice and have it on cruise control. We might get there in a few months, where it's certainly easier today than it was a month ago, but we're this is going to be quite a process until we get. I mean, there's going to be lagging indicators on this for a while that we should all be watching where the wind is coming from and shifting the sails in our practices.
Yeah.
And to your point, Dave, which I think is a very good question for everybody listening to think about. It's like, well, how are you going to adjust the sails and really focus on the direction you're going, right?
Right.
Do you want to are you set? You don't care. You don't want to do anything. You just want to sit back and be blown away whichever way the wind blows. That you can choose. That's an option, right?
Yeah, but I don't think anybody listening to this podcast would be of that ilk, right?
Yeah.
You're not listening to this podcast going, "Oh, I guess I'll just sit and wait it out," because everything we talk to is not about sitting around and living on what we've done in the past. It's all about how can we drive things towards the future, and whether that's technology or processes, it's all the different things we talk about are driving towards the future. So I think the people that listen to this podcast specifically are really going to be, they're not the bury their head in the sand people.
I agree with you with one caveat, which I think we should talk about on our next podcast.
Okay.
Knowledge is different than action, right?
Yes.
People may want to get the knowledge, but they don't put the horsepower to the road, right?
Yep.
And that's why I keep mentioning that throughout the entire podcast.
That is a really good point.
Right.
Yep.
So let's talk about that on the next podcast, my man. But for now, choose your suffering. Do you want to suffer for not doing anything, or do you want to focus on what I believe, the two main areas to focus on? Either becoming more profitable after this, which there's going to be, you could buy another practice, because they're for sale, right? There's good options there.
Yep.
I'm not saying that's not a bad option, or being more profitable. Thank you very much, sir. Great talking to you as always, my friend.
You do.